So Belinda Beck is a professor of exercise science at Griffith University Gold Coast and the Menzies Institute, Queensland. She heads the Griffith University Bone Densitometry Research Laboratory and co-founded the Bone Clinic, an innovative translational research facility and clinical practice providing evidence-based exercise for patients with osteoporosis. Graduating from the University of Queensland with a Bachelor of Human Movement and the University of Oregon with a Master's in Science and PhD, she completed a postdoctoral research fellowship at Stanford University School of Medicine in California. With a primary focus on the influence of mechanical loading, exercise, vibration on bone, the goal of Belinda's work is to develop evidence-based, safe and effective management and prevention for musculoskeletal conditions such as osteoporosis, stress fracture, and osteoarthritis. On this World Osteoporosis Day, welcome to Pure Health Hub, Belinda. Thank you for joining us.
Thanks very much for having me.
All right, so look, there are over 1 million Australians living with osteoporosis and 3.5 million living with osteoarthritis. These numbers are projected to grow to 2 million and 4 million, respectively, by 2022. Why is it that we can project such a high increase in these conditions in recent times?
Well, there's a couple of reasons, but the primary one is just that our population is getting older. So these are conditions that are far more prevalent in old age, and so when your population ages, there's just more of it, and so it also probably reflects to a degree the increasing sedentary nature of our society. So but we've been pretty sedentary for a while now. So but back in the start of sort of the 20th century, I'd say, we were much more active as a population, and particularly our kids. So that staves off these conditions a little. But yeah, it's really about the aging of Western populations.
So it is a little bit about lifestyle. But we really are just aging, and we're staying alive longer, and so therefore the deterioration, right?
Yeah, the same things that have caused both osteoporosis and osteoarthritis, forever, is still the same reasons. It's just that there's more of us. Yeah, and I should state, arthritis is probably not it's definitely not my primary field, because there is quite a difference between osteoporosis and osteoarthritis.
Well, that is my next question, actually. What is the difference between osteoporosis and osteoarthritis?
So I often laugh when clients come to the clinic and say, I've got osteo, and I say, well, that's very good. Everyone's got osteo, because osteo just means bone. But the difference is in the ends of the word. So porosis is exactly as it sounds. It's porous bone. It's bone that is reduced in mass and reduced in strength, so that it's got at increased risk of fracture. So imagine just a much smaller, more frail structure. That's what an osteoporotic bone looks like compared to one that's big, strong and robust. Osteoarthritis, the arthros means joint. And so the condition of osteoarthritis is in the joints, and typically it has to do with a degeneration of the cartilage that covers the ends of bone. And oftentimes that occurs because of injury to a joint or surgery. And so the bone reacts and sometimes overgrows around joints, but also the cartilage wears away. And both of those things make for a very painful joint, but very, very different, different conditions. They can coexist, but they are different.
Yeah, okay. Sometimes you just think that they're into it. Thanks for clarifying that. Osteoarthritis, though, just on a personal level, is it can also be genetic.
Look, I think you can have an increased propensity for either of these conditions. And in fact, genes determine sort of almost 80% of your risk of having osteoporosis. And probably you are more likely to develop osteoarthritis in response to an injury if genetically you're predisposed. But really, arthritis tends to be more of a response to repetitive micro trauma or overload injuring the cartilage than genes per se.
Okay, interesting. So are either or both reversible?
So in this case, I would say that osteoporosis is more likely to be reversible than osteoarthritis. You can certainly make your joints more healthy with certain kinds of loading, definitely, but it's very difficult to regrow cartilage. There's a lot of work being done with stem cell research and so on to try and regrow cartilage across the ends of bones. But the reason why there are so many joint replacements is because that's a really difficult thing to do. But in terms of osteoporosis, so we tend to lose bone across life, and people have always thought that's just an age-related thing. That's just what happens as you age. My belief is it is much more likely that it's because we become much less active with the certain kinds of activities that bone likes the most. So that reduction in loading, particularly jumping and landing, those kinds of activities become much less across life, and we lose bone. If you then reintroduce those kinds of activities, you can build bone back up. And we've certainly shown that exercise, certain types of exercise, are extremely effective at improving bone. But many of the exercise interventions that have been tested in the past have been of the wrong type. So there's been a little bit of a myth in the literature that exercise doesn't work, or at best it just sort of maintains and prevents the loss, but it can't build bone. And I've shown very clearly in our series of trials that that is not the case. You can grow bone, even when you've got advanced osteoporosis. The trick is not damaging the bone when you're exercising.
Well, I think that's the thing, isn't it? I think we start to feel like we're becoming a little fragile and so therefore don't want to do the high intensity. That's interesting. We'll talk a little bit about more of that in a second. And you mentioned there Mythbuster. Now, you're a prolific science writer and a self-confessed scientific Mythbuster. Can you give us an example? Is that one?
Yeah, that is one. But it irritates me when myths are created by people either making an assumption about something that hasn't been tested and then writing it as if it's fact. And this happens a lot in science, really? Especially in medicine. Yes, somebody who has a lot of experience and so they believe something to be the case, but there's no evidence. And they say something. It doesn't happen as much as it used to, but certainly it still does happen. A good example is years and years ago, this is in the 60s, there was a very famous orthopedic surgeon in Oregon who decided that shin splints, which is a painful overuse injury of the tibia, the shin bone, was caused by flat feet and the muscles around the leg pulling on the bone because of flat feet. Now, there was some anecdotal evidence that people with flat feet were more likely to have shin splints, but there was absolutely no evidence that that muscle caused it. And actually, as an anatomy student, I knew that muscle didn't attach anywhere near where the pain was. So this was very early in my career. I did a project where I dissected cadavers and looked at where the muscle attached and proved and said, mate, you're very smart. However, that's not true. And actually, the problem is coming from the bone loading itself. And that's actually what started me down the track of exercise loading for bone.
Right. So it was, and how did he take it?
Oh, well, look, I discovered this in the 90s. You know, this has been 30 years of misinformation in the literature, so he was probably dead. Yeah. So I expect he didn't mind too much at all. But I published a paper about this in 1994, and it probably took another 20 years for that to really be, for that misinformation to be unlearned and new information to take over. So you debunk the myth, but then you have to take on a PR campaign to re-educate, because it's all through textbooks and journal articles, and people cite and quote people without checking the facts, and it's always bothered me.
Yeah. Well, and so as a result, you're righting those wrongs. Good for you.
That's right.
Now, here's a beauty, and I think a bit of a debate between myself and my son. So, fact or myth? Do some people have light bones versus heavy or stronger bones?
Absolutely.
Yeah.
Thank you. Yeah.
He owes me now.
Good. Excellent. I'm always happy to support the sisterhood. So
people with light bones then perhaps more disposed or predisposed to things like osteoporosis?
Absolutely. And that's the whole genetic basis of osteoporosis. There are some families who just have less bone than others, and not just less mass per se, but bones that are a shape that is not as strong as some others. And, you can probably tell these people just by looking at them. You don't even need to x-ray them. If you think of the little bird-like grandmother, tiny skin little thing with skinny wrists and ankles, beside a very robust grandmother, who with very heavy set and still got a lot of muscle in old age and thick ankles and wrists, that person probably doesn't have osteoporosis. It's the little bird-like person with the small bones who does.
Yeah. Well, the European background, I think we're pretty good for the strong bones, hopefully. Now, this was something that I just had a little read on, but you published some reviews on the effect of exercise density. I found this really interesting on bone in postmenopausal women, and I wonder if you could walk us through a little bit of that in your two-part series.
Yeah. So we tend to study, there's a lot of focus on postmenopausal women with osteoporosis, because this is when osteoporosis tends to come to the surface. Estrogen is very protective of bone, and so when you go through menopause and that is withdrawn, you lose quite a lot, quite rapidly for 5 to 8 years. So that's why we do study, and a lot of our research is published in that area. And that's not to say that men don't get osteoporosis as well, just not as common. So I mentioned before how it's been thought in the past that exercise wasn't a particularly effective intervention for bone, for growing bone with osteoporosis. And if you look at a lot of the research that has been done, it would suggest that that is the case. When people would do their comparisons between the exercise group and the control group, you'd see that exercise maintained bone and stopped the loss, whereas the control group was losing. Now, when doctors looked at that result, they'd say, yeah, but I can give them a pill and they will actually grow bone, so why would I recommend exercise? And we always used to argue, well, okay, it's still good because it's still maintaining bone, but also exercise prevents falls. So a lot of the exercise recommendations for people with osteoporosis in old age was very much targeting falls prevention. So lots of lower extremity strengthening and balance exercise. Now, the idea that bone needs high loads of high magnitude or rapidly applied comes from evidence from the animal research, and it shows very clearly there's a linear relationship. If you unload bone, you lose. If you load bone the amount that you normally do, as a young person, young animal, you'll maintain bone. If you overload much more than the animal normally does, it will grow bone. So that shows us very clearly that bone needs overload. Now, everybody, including me, thought, oh, that's a bit dangerous. You've got somebody with a very frail skeleton. You don't want to overload them. So let's just do what we think is safe. And it turns out that safe level of loading is not enough to actually make bone grow. So finally I said, Well, we can't just go through life saying that exercise doesn't work if we don't actually test the kind of exercise we know that bone needs, just because we think it might be dangerous. We actually don't even know if it's dangerous. And that's what the Lift More trial was. It was the first trial in postmenopausal women with low to very low bone mass. Almost half of our sample actually had osteoporosis, where we tested a high intensity, so heavy lifting and impact training for 8 months. And lo and behold, we showed that not only did it grow bone beautifully, especially at the spine, but it was safe as long as it's supervised and it's introduced gradually with good technique. So this was another myth that was busted. Exercise does work and it is safe for osteoporosis. The key is supervision by experts, not just by your 6-week trained personal trainer. This is by somebody who knows what they're doing. They know anatomy and they've got some clinical training, like a physio or an exercise physiologist.
Yeah, right. So absolutely professional supervision. So the effect, I think that was the thing. There's making sure I knew, obviously, I always thought that exercise was an important element to that, but I always wondered whether you sort of think, well, I don't want to do too much because of various other injuries and things that go on, but you've basically busted that, right? So much stronger exercise. So when you say, so it's weightlifting, weight bearing, what would be an example? Is it more about weights, or is it things like Pilates and swimming and things like that?
No, so we know pretty clearly that walking, swimming and cycling, although they're fabulous, and please don't let the take-home message from what I'm saying be that, but they're not good. Those are fabulous exercises for your heart, your lungs, your brain, your metabolism. They're great, but they're not going to build bone. We've got plenty of exercise to show that they won't build bone. Right. They may help to keep your muscles a little bit strong, but really, if you're trying to stay on your feet, you need to exercise on your feet, not in the pool, not on a bike. You need to be lifting loads on your feet and landing with impacts. So the great thing about that we discovered as well with the Lift More trials, not only did it build bone, but all those other risk factors for falling that I said that we used to do. We used to try to improve lower limb strength and balance to prevent falls. It works for that too. In fact, it works much better than some of the lower intensity exercises. So it's like this double whammy. It improves bone and it prevents falls. But again, ordinarily I would do a research study and then I would publish it and I'd move on to my next research study. And the problem being with this one, it was not really, I didn't feel like it was ethical to do that. So that's why we set up the bone clinic, so that we can actually implement it in the real world and people can do it safely. And that sort of lets me sleep at night, so that I know that there's not this information out there that people are just going to go and take to the gym and hurt themselves, because they will.
Well, that's true. I mean, even younger people, we tend to not know our own strength. That does a bit of damage. Fascinating. So it is more about intensive. So now I understand you're midway through a clinical trial with a product called Vibemore. So could you explain this and the anticipated or potential outcomes?
Yeah, so many years ago, I was involved with a study to look at the effects of whole body vibration on bone mass. This was a relatively novel mechanical intervention. So it was thought to be something for people who hated exercise. Is this another way to get mechanical load into the skeleton as we age? And there are also some people who can't exercise for whatever reason. Their mobility is bad, or in my first study, I had somebody who was blind, and so she couldn't exercise alone. So it would be a really wonderful discovery if you can stand somebody on a vibrating plate, and it's a very mild vibration, but the plate moves very, very quickly. So some of the research that has been done in animals has shown that it is effective in building bone. Most of the human work has not shown that it's particularly effective, and certainly not more effective than exercise. But there hasn't been a big enough study done to test it for real. So I got a very large grant from the NHMRC, and we are testing whether this particular vibrating plate alone or in combination with our lifting program improves bone mass. So we actually have 4 groups. We have a control group, we have vibration, and it's 10 minutes a day. It's installed in people's homes. They stand on it for 10 minutes a day. Or the exercise group, they come to us and they train for 2 days a week, 2 sessions a week. So that's supervised. Or they have a vibrating plate in their house and they come to us. So those 4 groups, and we're going to compare them all and see if vibration works and if it's any better than exercise or vice versa. And so by the end of this trial, we've got about 250 people in this trial, so it's a pretty big one. We should be able to answer that question: does vibration work?
Yeah. Can I ask then, what made you believe that it could? I mean, you wouldn't undertake this obviously unless there was some positive signs there. So there were some early signs of that, was there?
Yeah, so remember when I was talking about the animal research, and I said that it was very obvious that heavy loads were most effective at building bone, but also loads that were applied very quickly. So, and when I say applying loads quickly, this is very quickly. So you can do it in a lab with an animal with an instrument, and you can apply the loads really, really fast. And those loads that were quite low in magnitude, but applied very quickly, did actually stimulate a change in these bones. But what we all knew is, well, the point is moot, because nobody can load their bones that fast. Even when you're sprinting, you're really only loading at about 2 hertz. That's cycles per second. And we're talking about loading at 30 hertz. And the only way you can do that is through vibration. So it's come from the animal research. How can we get that really fast loading into bone? Vibrating plates. Now, there are hundreds of vibrating plates on the market as already. They use some fairly ordinary research to support their claim that it's good for bone. There is some evidence that it does enhance the effect of strength training. So if you do some exercises while you're on the vibrating plate, it might enhance it. But there is very little evidence for bone yet. So it is still very much a watch this space. And when people ask me, well, should I buy one? You're doing a study. That means it works. No, we don't know. And I'll tell you when the study's done.
Well, that's exactly what I was going to say. In my gym, we moved up from Sydney, and the gym that I had down there always had those machines, and I even did a few classes with them, but I had no idea or concept of what they were for, but I thought they'd try them out, just do anything. Yeah. But so that's the story. So that somebody has already come out with these products, but there's no proof that they do anything, no evidence to show. Really?
For bone, yeah.
For bone,
People will come down on me like a ton of bricks if I say that they don't do anything for muscle. There's a bit of evidence for that. Okay. And they're kind of fun, it's a bit of a gimmick. We had a machine here for a while, because if they do work, they probably work mainly on the hips, whereas lifting works mainly on the spine. So it would be great to have that combination effect of lifting and vibration, and we could hit both of those really clinically relevant sites, the places that normally fracture with osteoporosis. But the machine broke down, so I just got rid of it. And when everybody complained, I said, well, we were only sort of using it because we had it. We don't know that it works. So we'll get one again if we find out that it works.
Well, if you find out, exactly. And when do you anticipate having those results?
Probably by the end of next year.
Yeah,
it's been it takes a long time to recruit that many people, and interventions for bone have to be prolonged because it takes a long time for bone to adapt. So it's a 9-month intervention, and you've got to get 250 people through that 9 months. So it's
Seems like going to be lucky if it's the end of next year, but so I appreciate that. Wow, so there's so much going on at the bone clinic and at the uni. So the bone clinic, just before I go on to a couple of other questions that a couple of our audience have asked, So the bone clinic, is that for patients? Are they referred, or is it more a medical to medical facility?
This is it is a clinic that is open to anybody, absolutely anybody, who has concerns about their bone. And we're talking about people from, as you know, we actually had somebody in who's a 10-year-old boy. That's the youngest we've ever seen. Normally it's sort of, but most of our clients are in early 60s, but it ranges right up to, you know, to late 90s. And these are people who have either the younger ones, it's normally their folks or their grandparents have osteoporosis and they're trying to prevent the hip fractures that they saw them have. Or it's somebody who's been to the doctor, they have a diagnosis of osteoporosis, they don't want to go on medication, so they're coming to us to see if our exercise program will help them to the extent that they don't need to. Right. So because we've only got the one bone clinic, the actual clinic itself, we licensed the program, the Oniro exercise program. So it is actually offered around the country by physios and exercise physiologists. So you can find them. We have a map on our website that we find them.
Okay, well, that's good to know. That's good to know. I'm sure they'll be very helpful. All right, we might just dive into these last two questions then. One of our readers asks, my mother has osteoporosis, osteoarthritis, and scoliosis. I'm petrified that I may inherit these conditions as I see her suffer in pain. Thinking of getting a bone density scan, but what else?
She doesn't say how old she is?
No, but I'd say 80.
So I would say the answer to the first question is just get a bone density scan. Absolutely. You won't know unless
this woman, as in the question, sorry, I was thinking about her mother. No, this woman's probably, 50, early 50s.
Yeah. So absolutely. Still, get a bone scan. Most people who fracture have never had a bone scan, so they weren't even aware that they had osteoporosis. And so it's a really good benchmark to know where you are, so that you can start taking preventative steps if you need to. I suppose if your parents have osteoporosis, there's a good chance that you will develop osteoporosis if you don't do something about it. If your lifestyle was very different from theirs, then maybe if you're very, very active, always ate a good diet of calcium and got vitamin D, you might be okay, but there's a very good chance it's in your genes.
Sadly. All right, so then another one is, what are the best preventative measures that we can take to keep our bone density up?
So again, this is very age specific.
So let's
these
talk
recommendations.
Let's talk about a 50s plus in that sort of 50, 60 decade, and then
Well, it's all about lifestyle. It's about making sure that you do stay as active as you possibly can and do the kinds of exercise that bone likes. But also, you probably need to have a look at your diet and see whether you are getting enough calcium, because quite often people who don't like dairy or don't tolerate dairy are not. So you need to be getting, when you're sort of in post-menopausal, perimenopausal, you need to be getting at least 1,000 milligrams to 1,300 milligrams a day. Now that is, I'm holding up the glass of water that I've got here, like a regular glass, and that'd be about 3 of those glasses of milk a day, or some equivalent like cheese, yogurt. Now you can get it through other forms of food, but dairy is just the most bioavailable, meaning the body absorbs it really well, and it's the calcium is very dense in dairy. If you have to go somewhere else to get your calcium, then you're going to eat probably need to really go foraging to get enough. If you eat salmon that is tinned, so you eat the bones in the salmon, or sardines, and so you eat the bones, that's a good source. But again, if you're vegan, you're probably going to need to think about reading some labels and finding foods that are fortified with calcium. You
right.
can take a calcium supplement.
Yeah, supplements, I was going to say, yeah.
Supplements are okay, but they are associated with, they've had a bit of bad press in recent years because there's some suggestion that if you take, over 500 milligrams of calcium a day, you increase your risk of a heart attack.
Wow.
It's because if you think about how we evolved, how our bodies evolved, we didn't take great big chunks of any one nutrient at one time. And when you do that, you have all this calcium floating around in your blood for some, your body's going, well, I don't need all this. What am I going to do with it? And what do you do with it? In some cases, is you lay it down inside your blood vessels. And if you do that in your cardiac vessels, then you're going to harden your arteries and increase your risk of a heart attack.
Right.
So also, if you take a lot of calcium supplements, you can increase your risk of kidney stones. You're definitely just best to take it in your diet if you possibly can.
Yeah.
If you are going to take a tablet, then spread it out across the day. Don't just take one big horse tablet at breakfast or something.
Yeah, we'll take all three or something. Yeah.
Yeah. And then also it's vital to get enough vitamin D, because it doesn't matter how much calcium you've got. If you don't have any vitamin D, you won't absorb it from your gut. So luckily in Queensland, we've got a beautiful sunny day.
Yes.
You shouldn't be out there in the middle of the day getting sunburnt, but a little bit of sun before the danger hours, just not enough to turn pink, but a little bit is really important to get enough vitamin D, because it's actually quite hard to get enough vitamin D in your diet.
Right, right.
The sources
and
are
it's effective, our natural sunlight.
Absolutely.
Yeah.
It's again, it's when you think about evolution, sunlight is a really important part of how we evolved, and it's probably the reason why the people who evolved around the equator are very dark-skinned, because that gives them some protection from the sun, whereas people far away are very light-skinned because their skin needs to get as much sun as it possibly can, to get that vitamin D.
Wow. Wow, this has been a fascinating chat, Professor Belinda Beck. Thank you so much for joining us. I'm sure it'll be received really well. So thank you so much for joining us on Pure Health Hub.